Hello everyone, good evening.
Hola, buenas tardes a todos.
Welcome to this online event.
Bienvenidos a este
We're going to discuss child and family reintegration, sharing monitoring approaches
evento
across the
online
regions. I thank all of you for joining us.
de
We
los
will be
niños en la
starting
reintegración de los
shortly.
niños en la familia. Vamos a
We
empezar.
request you to please complete the opening poll while we wait for other participants to join.
Vamos a esperar a los otros participantes que se unan a la llamada y mientras tanto contestan a esta encuesta. I'm going to translate what says in the poll.
Please take a few minutes to fill in the poll.
En la encuesta dice la pregunta 1, ¿has asistido a algún evento de Family for Every Child online anteriormente? La respuesta es sí o no. Y la segunda pregunta sería, ¿cómo has sabido sobre este evento? Pues la primera opción sería un correo electrónico de
We do
Family for
have
Every
a
Child, el segundo
Spanish
sería por
speaker
colega, el
and
tercero sería
there will be
la
interpretation
página web de Family
available.
for Every Child, el 4
As you
sería las
finish
redes
your
sociales de
poll,
Family y el
I
último
will explain
sería
to you.
online, otros.
Now, if you're done with your polling, I just want to explain to you. If you look at the bottom of your screens, at the right-hand side, you will see the interpretation icon. So you click on the interpretation icon to select language you would like to use, English or Spanish. And then once you've chosen your language, please mute the original audio. And if any of you have any challenges, please type your message in the chat box and we have Georgina who is around who will reply to you and help you. So welcome once again. So I'm just going to give you a little introduction about Family for Every Child. We are a diverse global alliance of 40 hands-on national organizations in 36 countries. We work with millions of children in extended family care, institutions, detention, and those on the move or without adequate care in their own families. Family for Every Child goals are preventing family separation, strengthening families, and ensuring
también
high
refuerza a
quality.
las familias y garantizar un cuidado alternativo.
Please check our two campaigns, United for Boys and Childhood on the Move, on our website. Just to give you context for our theme for today, we are talking about monitoring and evaluation of the integration programs. We know that international law and policy recognizes the importance of separated children back into families while keeping in mind best interest of child. The integration is a key intervention in the continuum of care, and the integration is defined as the process of a separated child making what is anticipated to be a permanent transition back to his or her family and community, usually of origin, in order to receive protection and care and to find a sense of belonging and purpose in all spheres of life. Family for Every Child, together with other international agencies, has developed international guidelines for integration, and it places clear emphasis on long-term process of the formation of attachment and support between the reunified child and his or her family community. And experience shows that a lot of organizations have challenges in monitoring and evaluation reintegration programs. And there are less models and approaches to monitor and evaluate. Just a note, today we are not focusing on the COVID-19 pandemic and the links to this, but just I want us to keep in mind that the rapid removal of street-connected children and their placement into families and temporary shelters as part of lockdowns in many countries, and children are stuck at borders or in transit and unable to complete their journey to extended family due to border closures. So we need to ensure rapid but safe integration to the response to COVID-19. We do have examples from our members who are facing this dilemma of keeping children safe in their shelters with a reduced staff, and also some children stating they wanted to go back to the families. We could probably take one or two questions at the end, but otherwise we're not focusing on this. We do have 3 panelists and the recorded presentations were sent to you. I'm just going to give you a top line summary of what these presentations are. We do have the first presentation from Connie. Diana Ruiz is going to present to us data compilation through monitoring and tracking instruments. Connie's presentation explains how they used to collect a lot of data. Now they're able to use that data about individual children and families and to understand their progress during and after the process of therapeutic interventions and the integration. This is done by using specific instruments and using those instruments to their requirements. They classified instruments to allow them to use the obtained information as any analytical resource. The instruments they use are family function scale, violence record, and home report. And in their presentation, they explained that they were able to collect qualitative and quantitative information about the population and the services, and it has been possible for the effectiveness of the programs. The possibilities to analyze information have become wider and clearer. And the presentation also provides results you can check. And one of the learnings is that they have found Family Profile, the tool that they're using, an outstanding tool for monitoring and evaluation. It contains a fast and updated consultation in real time about the information of families, their members, and important data that are necessary to track the therapeutic processes. And then we have a second presentation. You had the recording from Joanna Rogers from Partnership for Every Child, one of the members of Family for Every Child. Joe has presented to you on the monitoring and evaluation of reintegration of children with their families. And in the presentation, you would have seen that they focus on younger children, 0 to 5. They use assessment case management instrument, which is built on 7 domains of children's needs and how parents and caregivers are able to meet those needs. Then indicators are linked to these domains. They have output indicators and outcome indicators. And the way of measurement is by using child development changes, the family situation changes, risk assessment, services, etc. They also monitor individual child development using the different questionnaire based on the KIBR. And follow-up is an important part of the process. Some of the lessons that they have learned, they felt that overly focused on child development only. Interventions were having other impacts that they were not measuring, like the parents, women, and caregivers. Clients have characteristics that are important in terms of linking interventions and outcomes, and they were not fully measuring them, although they had data. And then we have Lopa Bhattacharjee, who will be presenting, or whose presentation you have seen from the RISE Learning Project. RISE Learning Network is a project implemented by Family for Every Child, together with 3 other agencies. And the project facilitates learning on recovery and reintegration approaches that improve long-term well-being of boys and girls affected by child sexual exploitation. And the focus regions for these projects being Latin America, Sub-Saharan Africa, and South and Central Asia. One of the three key learning outcomes of the project focused on monitoring and evaluation of reintegration of children. So they have developed this toolkit, and before developing, the project actually started with scoping and consultation with different practitioners and experts engaged in recovery and reintegration. And they found that a lot of M&E was done for donor and reporting purposes, focusing more on individual children for short-term results and less on the long-term impact, and not looking at the whole process of reintegration, like family environment and the long-term outcomes for children. So a key challenge was not knowing actually who was responsible for monitoring and evaluation of the child who was reintegrated, and also another key learning being lack of capacity for NGOs to actually monitor and evaluate reintegration. So they recommended that agencies facilitating reintegration need capacity to do proper M&D using participatory methods and including the whole process of reintegration and assessing the long-term outcomes for children. So the actual toolkit was developed using the existing framework from the HOPE project on M&D of the child recovery and reintegration, which was contextualized and updated in 2016 and later in 2019. Based on the evidence-based tools used by the practitioners and the 22 learning projects that are involved in this. The toolkit proposes tools for collecting and analyzing M&D data with and from children who access services from organizations, ideas on what could be measured to assess reintegration outcomes, and then the toolkit is for individuals, organizations in their integration work, for those planning reintegration programs. It's also used for policymakers and those overseeing the integration efforts. The toolkit has three sections. Section A, setting a conceptual understanding of M&D and participatory approaches. Section B consists of how range of M&D can be done using participatory methods and plan for M&D, which is divided into 8 domains of the integration works. And then section C has examples of outcome indicators. I'm going to quickly talk about panelist biographies. We have Lopa Bhattacharjee, as I mentioned. Lopa is a senior program advisor at Family for Every Child and leads the sexual violence, reintegration, and child participation thematic areas, together with managing the RISE Learning Network implemented by Family for Every Child. Lopa is a child protection practitioner for almost 20 years. Lopa's educational background is in economics and in software engineering, but started off her career as a social worker and has a range of experience of working with community-based organizations, national CSOs, and law enforcement agencies. Lopa has spent several years supporting children withdrawn from situations of trafficking and sexual exploitation. Lopa chaired South Asian regional action forums focusing on care and protection of children and women affected by sexual violence, and headed the child protection programs of terrorist zones in India from 2008 to 15. Lopa is also an active child safeguarding specialist, supporting different organizations with special focus on preventing child sexual abuse. And we have Diana Ruiz from Coney. Diana is responsible for monitoring and evaluation at Foundation of Coney in Mexico, and oversees implementation and development of projects related to the improvement of process for the collection and systematization of population data and design implementation. And Diana is an anthropologist at the Benemérita University in Pobla with 6 years experience, specializing in the collection, analysis, and interpretation of data under the social approach. Diana has also received training on management, reporting and data analysis, as well as on issues related to work with vulnerable populations. Diana participated in International Congress, Breaking On Cycle 2016 in Ton of Violence, workshop on visualization of data on children and adolescents, and workshop on use and presentation of hard data in Tableau, diploma in therapeutic educational basis for work with people affected by violence. And our next panelist is Joanna Rogers. Jo is head of strategic development and partnerships for Every Child in Russia. And she's the founder and senior consultant of the P4EC consultancy group. She's also an associate consultant at Oxford Policy Management. Joanna has a master's in social work from Specialist Social Work University in Stockholm. She has worked on child protection and family support system reform in many countries around the world, including China, Russia, Mongolia, Tunisia, and Slovakia for over 25 years for both NGOs, governments, and international agencies like UNICEF. Jo is also currently heading a P4EC consultancy group team, providing technical assistance to a joint UN agency's SDG fund program in Turkmenistan that aims to develop community-based social services for children and adults. She is also advising the Asian Development Bank on disability inclusive development programming. Jo is an expert in M&D and social service system reform, child and family support, disability policy and programs. We're so glad to have 3 panelists who are experts on the theme. Now we go to live question and answer session. Thank you once again for joining us. Please remember to type your question in the Q&A box and not in the chat box. So the Q&A box is somewhere in the middle of the screen at the bottom. Please also say who your question is directed at. So once again, for those of you who have just joined, today's online event is on monitoring and evaluation of reintegration of children and families. And we have 3 panelists who had presented the presentations. Some of you have seen it, others you could see later. So questions will be based on that. Please welcome to the live Q&A answer session. While we can start asking the 3 panelists some questions that I have here, I would start with Jo. Jo, can you please give us an overview of how you developed your M&D instruments and over what period of time? While Jo is answering, please remember to put your questions in the Q&A. Welcome, Jo.
Thank you, William. Hello, everyone. We developed our monitoring and evaluation instruments over quite a long period of time because we used our case management instruments as the basis for all monitoring and evaluation, and then gradually added, as our services developed, other different instruments for, measuring specific indicators. So, over several years, this wasn't a system that started immediately, completely thought out. And, we tried to learn lessons as we went along in order to improve the way we were monitoring. And in the presentation, I spoke about the way that we try and monitor child development. And we were able to build on the work done by one of our partners in St. Petersburg in Russia called the Early Intervention Institute. They had done a lot of work to translate and adapt instruments that were developed in the US and they adapted them for use in Russia. And so we were able to use those instruments and for our staff to be trained in how to use them, because we have a strong partner who had done that kind of work. So it wasn't always just us. It was, we were trying to build on other work that others had done.
Thank you, Joe. We are going to ask Diana a question, and Diana is going to speak in Spanish. So remember, those of you who have just joined, select your language. At the bottom of the screen on the right side, you have an icon where you can select your language. And once you have selected either English or Spanish, please, at the bottom, you will see mute original audio. So once you've selected your language, please mute the original audio. And any trouble, please message in the chat box. So Gianna, welcome. Thank you for joining and for your presentation. So in your presentation, you categorize the importance of the information you collect about families into 3 instruments: family functioning scale, violence brief. Welcome, Diana. I'm not hearing Diana.
Sorry, I was just saying that I
Okay.
couldn't hear what you said, William, because there was some problem with the connection. So you were saying something about the 3.
Okay, I was asking question to Diana. In her presentation, she categorizes the information that they collect about families using 3 different instruments, which are family function scale, violence record, and home report. Can she explain briefly each of these, in brief, the 3 instruments that they use in their monitoring and evaluation of reintegration?
So the instruments that we were using, they have 2 parts. So one of them is for the families and the other one is for the children. And these family instruments give us a very specific follow-up about or information about the process that the families are experiencing. So in this case, we can have from very specific detail about the family dynamics, we can know which strengths they need to be worked on so that we can have a good environment, a healthy environment in the family, and so that the dynamics in the family, within the family, is safer and best. So regarding the violence registry that we have, we classify violence in 5 types. Each of them is measured regarding the different violence events that they see and how often they are repeated. So from this, we see the level of violence that is within a family. It can be financial violence, physical violence, active physical violence, sexual violence, and emotional violence. So we measure how severe they are and how many times they are repeated within the family. So from here, use strategies, the therapeutic process, so that this is corrected gradually with levels of violence. So the last report is the report that we have, and from this we have a lot of information because we can have a socio-economical profile from the families that we're working with. So we're working with the therapeutic side, and also we try to empower the families so that they can have their own process, and so that they can have family dynamics that are healthy and that's so that they can have the dynamics, so they can have a better man in their families.
Thank you, Diana.
The information is collected every 6 months. And it's updated real time. We can have very, very good reports about what the process is about in family. So this instrument, as you can see, have 3 main goals. The first of them is to measure the family dynamics. So how healthy it is, for example, see the different fields where the therapeutic process needs to be reassessed. The second goal is helping us to observe the different violence levels and where the strategy needs to be more strong. And the last one gives us information about their socio-economic situation so that we can know which strengths these families have in order to be in a safe environment and not be in a risk environment from their activity. I don't know if you have any other question regarding my presentation.
Thank you, Diana. We have one question coming from Jonathan Hane. That is for Hukoni. Diana, question for you. Are the databases and monitoring systems proprietary, and do they involve financial payments to third parties? Am I clear? Are the databases and monitoring systems proprietary, and do they involve financial payments to third parties? That question is to Diana from Hukoni.
Okay, so we're just changing the interpreter, just a minute.
Sure. While, yeah, please.
Gracias. So this about the data and the system that we have used is something we're very proud of it, and that we can share it with all the organization here in this event of Family for Every Child. Because this system, it was generated by Connie, and it has been a very arduous job, and fortunately it is sustainable, and it has different characteristics that allows that it can be used in other aspects of other countries. So this country, for monitoring, it has only applied that we had to invest in programming and invest in modality that Hukoni has, and it has required that we can use that it can use in at all levels of the program Hukoni. So it is to say that every time that we do not require a provider for these systems, we have designed a system that we can use one-to-one on a face-to-face basis, so that the database has been understood for everybody, to all the families that we have been looking after. So in this case, what we have, it's a license of this system, and the intention is that to participate in this event as we can share this experience so that we can enrich our work and that we can learn from it. And I think this has been a very a job of innovation, and now we're working also in making changes and improvements so that the information of the data can be read faster. So this is very important information, that the system was used within Hukoni, but it has a good aspect that you can use it everywhere in other countries and in another other users can use it easily.
Sorry, the question is also addressed to Joe.
Yeah.
Whether the databases and monitoring systems proprietary, and do they involve financial payments to third parties? Joe?
Yeah. Yeah, it's a really good question because, you know, there are a lot of instruments for assessing and monitoring and so on that are copyrighted and, you know, do require payment of a fee or a license. In our case, everything that we've developed has been adapted. Either we've developed it ourselves in the same way that Kony has, or it's been adapted from materials where we have had permission to use. So our assessment triangle, for example, was adapted over a long period of time with a range of different Russian practitioners and academics, having had permission from the Department of Education in the UK. At that time, they were responsible for developing the assessment framework. So we had permission to use the original, and the adaptation is ours, if you like. And our model of working is that we try and develop and model services and ways of working that can then be replicated by other NGOs, by local authorities. So, you know, as with Kony, you know, we don't obviously charge anyone for using our approaches and methods.
That's good news. Thank you. Thank you, Joe. Before going to Joe, another question by Raju. I just thought we will listen to my colleague's Lopa's voice. Lopa, I have a question for you. In your presentation, you say the RISE toolkit for MND of integration includes guidance on how MND can be done using participatory methods. I thought that would be an interesting one. Can you please explain that a bit further?
Thank you, William. Hello, everybody. Good evening from India. Yes, the RISE toolkit does have some directions and examples of participatory monitoring and evaluation tools. And they are also explained quite elaborately how you can use them. Just to give you also an example from one of the learning partners who had participated amongst the 22 learning partners which William had mentioned at the beginning. This particular learning partner from Kenya had used one of the tools called the diaries, which served as a participatory tool that facilitated the direct engagement of children living in institutional care and were receiving psychosocial support services. They were asked to record their emotions and feelings and their experiences in their diary, in their own individual diaries, and they were also asked to complement those experiences with drawings or any other creative representation that they may have liked based on their own individual choices. And these particular diaries were then followed up by the social workers. And it also gave an understanding of the progress or how the child felt over a course of period. And also it gave feedback on the particular psychosocial support services that they were receiving from the organization. And as a result of implementing this particular tool called the diaries, the organization was able to effectively track the recovery progress of the girls who were, in this case, they were all girls who were feedbacking through the diary. And they were also able to better ascertain, the level of preparedness for reintegration into family and the community settings. And in terms of, they were also feedbacking a lot on their experiences regarding the quality of psychosocial support that they were receiving. And according to the children and their feedback, this seemed to have created a safe space for them to write down their emotions and feelings, and also provide feedback in a non-threatening and safe environment and in a safe manner, as well as using creative methods. You know, these are, and there are quite a lot of other examples similar to what I've just shared in the toolkit, which could be used. And those tools also have guidance around how you can use, and also elaborates further on the benefits and some of the risks that might be involved when engaged in participatory methodologies, not only with children, but also with families and communities.
Thank you, Lopa. We have two questions from Raju Gimire from Nepal, one of our members in Nepal, Voice of Children. And just for you to know that family has several working groups, and one of them is reintegration, and Voice of Children is an active member in that. So Raju is asking, how can we monitor if family is giving fake information to the social worker? He's asking this particular question to Joe. So Joe?
Yep. Yes. Thanks, William. Thanks, Raju. Yeah, good question. So the way that we work is that our social workers are engaged on a regular basis in visiting families. So they often go to the family home and spend time there, talking to parents, talking to children, observing the interaction between children and parents. Sometimes they are, you know, together with the parents and the caregivers and the children, going to other places. So they might also go with the parents, for example, to the kindergarten where the child is attending, or to visit the family doctor to talk about health issues. So they have quite a close, in-depth engagement with the family. So on the one hand, yes, our monitoring and evaluation systems rely on the feedback we get from families, from parents, from caregivers, from children themselves. On the other hand, you know, the professionals, the social workers who work in our services, they make their own observations and conclusions from these visits. And in terms of indicators, if you look at the presentation that we did, we use a triangle, an assessment triangle, which has 7 domains of sort of children's needs that need to be met, and that may change over time as children grow and change, and also may be different, for example, for children with disabilities or with other types of special needs. And once we see an improvement across all of these 7 domains, then we can start to think about stopping working. But in terms of reintegration, I mean, Lopa talked about the RISE program, which, you know, we do use a slightly different way of assessing, but essentially trying to understand whether a child is safe, you know, developing in the way they need to, accessing all the different aspects of their well-being, if you like, that are important. So, for example, in reintegration from residential care for older children who are of school age and need to be attending school, you know, that will be one of the indicators, will be how are they doing at school? You know, are they attending? Are they getting the support they need from their family to be able to participate in school properly? And there will be a follow-up period that will last as long as it needs to. Typically, it's around 6 months for us, but it can be shorter and it can be longer than that, where we will be tracking these different aspects, you know, of the child. And I mentioned in our presentation about indicators of younger children. You know, if we see that a younger child's development is delayed in some way, then that means we need to keep working with the parents, with the caregivers, to make sure that the reintegration is fully successful. And at the moment, in fact, we are developing a more in-depth parenting program to help address some of these developmental aspects, to make sure that, you know, the families we are working with are not only providing basic care, but are also attending to their child's developmental needs. I don't know, I hope that answered your question.
Thank you, Joe. I think Raju is also asking if even Diana can answer that question. Diana, what can be indicators for successful reintegration? And what tools can you use? Maybe we can break this into two. First, think of some successful indicators for reintegration from your side, Diana, and later if Luego wants to add one or two.
Yes. We have different tools, like we said in the presentation. From them on, that's how we know what are the strengths that have been worked properly by the family during the therapeutic process, so that there is the point of reintegration. What it has helped us a lot is to make a classification of the tools from our needs. Instead of having to know which tool to use, we go a little bit backwards, and then we start a very long process, but we want to invest some time in it, because from then on is that we can get best information. And what it helps us a lot is to think about what needs do we have in regards to the reintegration of the families that we were looking at. And we need to know the levels of violence, what the violence is the one that we have to work with the family, and which were the things that we have to strengthen so that the family will be exposed to these risk situations. And then we start from then, so that we could know which tools to use and that will be going to work for us, not only during this process, therapeutic process, but also to gather data that it will be useful when we were going to give feedback and do the analysis that generates the therapeutic, so we could give a better attention with the families. In regard to all these indicators, I think it is a very follow-up work, and we have to do it constantly, and also the monitoring and evaluation, because it doesn't depend on how successful the indicators could be. It also depends on what is it that we really need to observe, and the process of M&E in our experience. It also has been, and take a step backwards, ask what needs do we really have? What do we want to obtain? And what things that we want to show? And where do we want to go with this information that is showing that it's, and where are we going to share this information with this experience, so that from then on we can start and establish technical questions in regard of the tools of indicators, and of course to generate our indicators from what we already had. So it's more an analysis of to see all the needs that we have, and mostly on this process, we have to invest a lot of time, and we have to talk to the people that are working with the families, we educators, the coordinators, to know how is it that they can improve their observations in quality like in quantity times, so we can establish the elemental technical elements with the follow-up tools.
Thank you, Diana. Maybe we can get more clarification on that also from Joe and Lopa. In both your presentations, you mentioned that before you see that your instrument is built on the 7 domains of children's needs and how parents and caregivers are able to meet those needs, and the indicators are linked to these domains. Maybe very quickly, could Joe mention those 7 domains of children's needs while I look for the other questions. And those of you join, please put your questions in the Q&A and not in the chat box, because I'm not looking in the chat box. I can access your questions in the Q&A box. Yes, Joe?
Yeah, so the 7 domains of children's needs, developmental needs that form part of our assessment triangle are health needs, education, emotional and behavioral development, identity, family and social relationships, social presentation, and self-care skills. And so we are looking across all those 7 domains at the beginning of the integration. So we're looking at the potential for the family to meet those needs in terms of basic care, ensuring the safety of the child, emotional warmth, stimulation for development and emotional and behavioral development, guidance and boundaries and stability. And then we're also looking at the sort of environment, family and environmental factors around, you know, basic income, employment, housing, the living conditions, etc., family functioning. So we do assessments at the beginning of the reintegration process, the middle, you know, and the end. In fact, constantly using a case management method. So we're constantly reviewing the situation for the child and the whole family across all those different elements. And you know, those are what we monitor.
Yeah, thank you. And Lopa also mentioned in your presentation, you spoke more about the planning of M&D work around 8 areas. Can you briefly summarize, Lopa, before we go to the next question that is in Spanish, something related to COVID? So Lopa, since the toolkit suggests planning M&D work around 8 areas or the 8 domains, maybe just only to mention those domains.
Yeah, sure, William. Thanks. Yes, it's quite similar to what Joe has suggested. So in the RISE toolkit, there are 8 domains, which are around the different aspects of reintegration programming, which are basic needs, shelter and protection, legal support, health care, psychosocial support, education, economic strengthening, family strengthening, and the last one is community sensitization. And for each of these domains, you would find examples of objectives, outcomes, outputs, and some selected indicators. And there are also examples of methods to collect the data, to measure those indicators as provided in the toolkit. But I just wanted to also slightly elaborate, William, based on what is provided in the toolkit, is also when we are formulating indicators, it is also important and recommended to consult with children, and that needs to be context specific objectives and indicators. And to be able to have children's participation and view in terms of what successful reintegration would look like to them. And again, the toolkit provides some guidance around how you can then engage them in formulating those indicators. Thank you, William.
Thanks, Lopa. Can one of the interpreters please look at on the screen and help us to interpret this question that is in Spanish? Maria or to Diana.
I think Maria will translate
Can you
in your chat.
in the chat, is it? Okay. So we have, thank you for having a question in Spanish.
Yeah,
It's from Adriana.
Yeah, I can see the question from Diana. It just said if you connect by iPhone in the screen, and I think it's something about muting the screen.
So it's not question.
It's not question, no.
Okay.
It's
So
about, yeah.
earlier I had seen a question on COVID and then sorry it disappeared, but I do have also a question related to that. If whoever put that question, if you want to kindly put that question back. Otherwise, I want to ask Joe or any of the panelists to just tell us a little bit about how the COVID-19 pandemic is affecting your work in this area of reintegration. Joe, you want to start and maybe others can...
Sure, I can start. So we had some cases, reintegration cases that are ongoing, as it were, at the point when the crisis hit, and we've gone through a process of prioritizing cases that require, you know, continued visits. But basically, our team have all been working at a distance since 23rd of March, and that has involved using phone conversations and some apps like WhatsApp, and also we have been providing. So basically, there's we're finding it quite difficult. We're sort of experimenting at the moment and trying to monitor how things are going. And so far, we can see that sorry, my daughter's interrupting me. Just 1 second.
Working from home.
It's just she's got a class starting in 5 minutes and she needs something from you. Let me just quickly finish.
Okay.
Essentially, we're struggling. We're experimenting. We're working at a distance. We are working with our partners from the child protection authorities to monitor if there are any issues arising in terms of families. This isn't specific to reintegration, but to, you know, our active family support, where there may have been child protection concerns. You know, we are monitoring with our partners that situation. We haven't yet set up any new referral mechanisms for whether reintegration or prevention cases, but we're in the process of looking at how we can do that. And essentially, we're working remotely. We are doing some additional kind of material support to some of our families who need that sort of support. And I just wanted to note one point that might be interesting to listeners, is that we have noted that some of our cases that were closed maybe 2 or 3 years ago even, have come back in contact with us because they are struggling. Some of these are, you know, former reintegration cases. So, you know, I think for us that's a note that there is this uptick in need, and we're going to need to think about how to support families with this.
Thank you, Joe. Just want to ask Diana quickly, if you want to throw any light on that, how you are managing your reintegration work during this COVID situation, anything that might help our listeners. Otherwise, I have one last question. Tiana?
It's the same as the other organizations. We're trying to work at the distance with the families. We're trying to find a way to give them a therapeutic support and to give a follow-up. And we're trying to do a telephone call, and they can, if to account the calls, because it's the only way that we can have a link and to be connected with the families and to have an empathy, and to try and have a better connection with the family. And we have reduced all the data, gathering of data, because we can't do it. We're going to give priority with the supporting therapeutic for the families and for the children. And this is how we have tried to work. We know that the information or the updated of the information is going to reduce, but at least we're trying to give therapeutical support for the families and children.
Thank you so much, and we have to wrap up now. Thank you for the three panelists for preparing your presentations and sharing with us and answering the questions. And all the I just want to say that the toolkit from the RISE project is really practical for those of you who want to use. There are a lot of tools there, and Hukoni's model, I think an interesting thing that you find in the presentation is that if you look at it, there's not only demographic instrument, but there's also emphasis on the emotional instruments that they use to capture information about individuals. And for every child, their model of working not just with children but with families and children 0 to 5, and their instruments also is in touch with them to learn more about their instruments. Thank you very much.